Here's a case of a 63-year-old male presents with a bump on the dorsum of his right foot, and he was quite tender to it on palpation, on physical exam. He had this for about 3 or 4 days, but since he was quite tender, we decided to go ahead and do an aspiration, and that simple procedure actually gave him immediate relief and relief upon follow-up visits. 63-year-old male here for pain in the right foot for about 4 days. An episode of this about 6 months ago. On physical exam, he's really tender right on the dorsum of his foot, near the cuboid. He describes pain on the inner part of his ankle, but really when you examine him, he's just tender over here to touch. Not much pain over the medial lateral malleolus. He says he has pain with walking, no fever, no chills. Also, you could appreciate some lumps here under the skin. It looks like he developed some ganglion. So we're going to go ahead and do an ultrasound and just look at that and see what that is made out of. It is in fact a ganglion or just some fatty type tissue.
Right.
Right there?
Wait to the little bumps there as well.
This one. Not this one. This one.
Yeah.
You got some muscle, and then you got that little cyst underneath it. It looks like right above this cuboid. And here you can see that ganglion right above the cuboid. You can also easily see the flexor digitorum brevis muscle as well. I'm going to reverse my probe. Right side of the screen is distal, left side is proximal. Here we are at the junction of the cuboid and the calcaneus, it appears. And here's a nice little breakdown of the bones. You can see the calcaneus at the left of the screen articulating with the cuboid, which is essentially in the middle of the screen. And do another little Doppler just to kind of ascertain whether there is any color in it. It looks like there's not. Is this where your most tender part is? When I examine you, it seems like you were most tender over here.
Yeah.
I'm trying to get a little view of his ATFL. But it's fibula on the left side, and then talus on the right side. It looks intact. So here's the ATFL, somewhat a little indistinct, but you could see those compact fibular type fibers of it. I see a little fluid there. I mean, we could try draining it. You want us to try to drain it, inject with a little cortisone, see if that helps. You want to use a big needle for these because it's freezing my hand. We have to kind of backhand it a little bit here. It looks like we arrived.
It's very big.
You see stuff coming up?
Mm-hmm.
Yeah, it's also good to try to break it up a little bit here so it doesn't come back. It's got thick ganglion type fluid. And that's our cortisone with a little bit of, you put a little lidocaine there, you said?
I did.
Okay, that was nice. So about 2 months after a ganglion drainage from his right foot, and really since the procedure he's been doing pretty well. Have you had any kind of discomfort that you had before the procedure since the aspiration, or not really?
No.
You've been feeling okay?
Yeah, really. Down there.
So today in the exam, really no pain over the dorsum of his foot. His ganglion was basically right on the dorsal lateral aspect of the foot. And he had no pain over the medial malleolus. So, I mean, just simple procedure like that really went a long way. He's 2 months out. This is a case of a 24-year-old soccer player who presented with about 6 months of pain in his left ankle. He had an MRI which showed a partial tear of the peroneus brevis tendon and some tendinosis of the peroneus longus tendon. We did an ultrasound which confirmed that he did have a very subtle small tear in the peroneus brevis tendon, but it did show also a split in the peroneus longus tendon just distal to the lateral malleolus. There's a 24-year-old male here for pain in the left ankle going on for about 6 months. He was playing soccer and twisted it. He really hasn't played any sports since then. Still has a lot of pain with walking. He tried some therapy, tried using crutches for a month, which did not help. And most of his pain seems to be in the region of the peroneal tendons. MRI basically showed a split in the peroneus brevis tendon, a partial type thickness tear in that tendon, as well as some tendinosis of both the peroneus longus and brevis tendons. We're going to go ahead and just kind of focus on those tendons. On physical exam, he basically has tenderness mostly right in this region of the peroneal tendons, but also some pain over the ATFL. A little bit of pain in the anterior tibio-talus joint line. Otherwise, he's got good motion. and really not that impressive otherwise. We starting proximal. You really just see the peroneus longus tendon, and then you got the peroneus brevis muscle underneath it. And here you can see the peroneus longus tendon, underneath that just a little slip of the peroneus brevis tendon with the peroneus brevis muscle underneath it. Go distally, and then you can see the peroneus brevis tendon come into play. And here you can see the two tendons again, just right next to each other. You got the superior peroneal retinaculum right above that. You can see it right here, that little tiny split. And this is a very subtle split in the peroneus brevis tendon. Maybe. You can see the peroneus brevis tendon on the left, peroneus longus on the right. Here we are below the tip of the fibula, and we're at the inferior peroneal retinaculum. And as we go, you see the peroneus longus tendon just dive down deep. You can see that peroneus longus tendon dive down in a plantar direction. Also, you can see a split pretty clearly now in the peroneus longus tendon as it goes in a plantar direction. You can see that brevis tendon now basically just going to the fifth metatarsal. Going back proximal, and you can see how those two tendons join. So this was a case where the MRI did not show a tear of the peroneus longus tendon and ultrasound did. And the MRI did discuss a tear of the peroneus brevis tendon, but ultrasound shows that it just is a very subtle small tear of the peroneus brevis tendon. So this is a 43-year-old female. She presents with pain in the right ankle in the vicinity of the tibialis posterior tendon going on for about 6 months. There was no injury. She had pain with walking. She did present with an MRI which showed a split in the tibialis posterior tendon. We did an ultrasound in the office which showed fragmentation of the tibialis posterior tendon as well. She is a 43-year-old female with pain basically this side of her ankle for about the past 6 months. About a year ago she had pain at the heads of the third and fourth metatarsals, but that resolved. Now she has pain over here. MRI does show fluid and thickening of the tibialis posterior tendon with a split in the posterior tibialis posterior tendon. Also a lot of cysts in the medial talar dome as well, which I think also was contributing to her pain. We're just going to take a little look here at her tibialis posterior tendon. And we can see the tibialis posterior tendon just right next to the tibia. You can see that it's somewhat fragmented and there's some fluid around it, more than you would expect. This is obviously our axial view. Right side of the screen is posterior, left side of the screen is anterior. And here you can see that fragmentation of the tibialis posterior into multiple bundles with some fluid around it as well. Again, the fragmented posterior tibialis tendon. You can kind of see flexor digitorum tendon just posterior to that. We're putting on some color Doppler, and that's your posterior tibial artery pulsating right there. So here are the structures that you can delineate out with the artery and veins, and then you have the flexor hallucis longus tendon just posterior to those vascular structures. Here we are, we can see tendons pretty clearly. You don't want to mistake one of the pieces of the tibialis posterior tendon for the flexor digitorum longus tendon. And here they are in color. And the sustanaculum tali is a good landmark to distinguish between the flexor hallucis longus tendon and the flexor digitorum longus tendons as it divides the two. And also you want to keep in mind the flexor retinaculum that is superficial to these tendons. So here's some fluid around the tendon, which you can normally see around the tibialis posterior tendon, just distal to the medial malleolus. But usually that's just a little bit of fluid on one side of the tibialis posterior tendon. In this case, there's more fluid than you would expect, which is consistent with his pathology of tendinosis and tearing. We're starting axial with that tibialis posterior tendon. I'm just going to turn. And you can certainly see that fluid around the tendon. In the long axis, it's difficult to differentiate between a split in the tendon versus whether it's two tendons. Here we are again, and I believe this whole thing is tibialis posterior tendon with a little split in it, particularly as it goes around the medial malleolus. This is going around the medial malleolus and See how thickened that tendon is. And I'm going to go posterior, and there's our flexor digitorum longus tendon, and we can follow that up. Again, I think we're at this point just focusing on flexor digitorum longus tendon. Does have some fluid close by. And again, here is more fluid than you would expect, consistent with pathology. So this is a case of a 24-year-old male playing basketball, injured his right ankle. He had pain that persisted for about 6 months. We went ahead, we did an ultrasound, and the anterior tibiofibular ligament basically showed some irregularity consistent with a partial tear, and also there was a calcification within the ligament itself. At that point, we decided to get an MRI. So this was a case essentially where ultrasound confirmed that it wasn't just a simple ankle sprain, there was still some residual tearing and calcification within the ligament. This is a case of a 23-year-old male who twisted his ankle playing basketball and basically had some pain with walking and pain mostly over the anterior tibiofibular ligament. Physical exam, he was basically tender over the lateral malleolus and the anterior tibiofibular ligament. He did have some mild pain with inversion. You can see his MRI here shows some speckled calcification within the ligament itself. Here's his ultrasound, basically the probe right over the anterior tibiofibular ligament, and you can see that calcification within the ligament itself, and above the calcification you see some hypoechoic signal consistent with a chronic partial tear. And he had pain here for over 6 months, and that's why we decided to get an MRI. And here's a comparison view of his normal ligament compared to the injured side, which is on the bottom of the screen. And you can see how the normal ligament is essentially consistent, compact fibular fibers that go across from the fibula to the talus, as compared to the injured side, where you see some irregularity of the fibers and calcification. This is a 26-year-old female. She fell down some stairs and had some pain on the right foot. Most of her pain was essentially in the region of the sesamoids, right under the first MTP joint. X-ray did show a subtle fracture of the medial sesamoid, and ultrasound also shows that fracture as well. Ultrasound is useful in these cases as you can perhaps avoid follow-up X-rays and just follow the fracture with ultrasound and see how the callus fills in the gap of the fracture. This is a case of a medial sesamoid fracture in a 26-year-old female. She basically fell down some steps and had difficulty walking. She had a burning type sensation on the balls of her right foot in the region of the sesamoid. Physical exam showed a lot of tenderness over the sesamoids, essentially, also over the anterior tibiofibular ligament. So here we are, we're doing an ultrasound. In a sagittal view, we can see the flexor hallucis longus tendon very clearly, going over the proximal phalanx as well as the first metatarsal. And here we are at the medial sesamoid, where we can clearly see the fracture line in that bone. Also, we can see the flexor hallucis brevis tendon inserting on the base of the proximal phalanx as well. And as you go a little lateral, you can see the flexor hallucis longus tendon come into view. And then here's our lateral sesamoid. And here's just another view. You can clearly see the flexor hallucis brevis muscle, the lateral head, feeding into the lateral sesamoid and the proximal phalanx. And as we go proximal, we can see that flexor hallucis longus tendon and underneath the flexor hallucis brevis muscle medial head. Here we are in an axial view. You can clearly see the two sesamoids. You can see the fracture on the medial sesamoid, and also anisotropy causing a black circle for the flexor hallucis longus tendon. And then as you toggle the probe, you can clearly see the flexor hallucis longus tendon, and also you can see that slip of the plantar aponeurosis overlying the flexor hallucis longus tendon and the sesamoid bones. And here we are just toggling the probe, and that flexor hallucis longus tendon comes in and out of view. And again, you can see the fracture, and this is a good way that you can assess how a fracture is doing. You may avoid getting an X-ray on follow-up visits and just follow with ultrasound to see how the callus is forming and how the bone is healing. This is a case of a 58-year-old female with pain in her right foot. She had pain over the second metatarsal. Her x-ray was negative for any pathology, however MRI did show a stress fracture in the second metatarsal. Ultrasound also was able to reveal callus formation around the stress fracture, and you can use ultrasound to follow her clinically. So our patient, a 58-year-old female here for evaluation of right foot pain for 3 weeks. We did an MRI which shows a healing stress fracture of the second metatarsal with significant bone marrow edema in that region. Also showed an neuroma in the third web space. We're going to evaluate that on ultrasound today. We can also take a peek at her second metatarsal. Maybe ultrasound might look at it differently. Our x-ray really didn't show much. Here's our first clip. We're just looking at the second metatarsal. Right side of the screen is proximal. And we're just following that cortex down, looking for any kind of subtle step off. So here you don't see a step off because she is well into this injury, but you do see a nice smooth callus formation over the fracture site on ultrasound. You don't see this finding on x-ray. You could see a little bit of a bump here, and I believe that's where her callus formation is from a healing stress fracture. Here we are again, we're going distally to the left. And here's that proximal part of the second metatarsal, which looks fairly well preserved. You can see that callus formation there, a little bump kind of in the distal third of the diaphysis. And that's callus formation from a healing stress fracture. And then we can follow that all the way to the MTP joint. So this is a good case where ultrasound is pretty sensitive and can actually find callus where you did not see it on x-ray. And ultrasound can be useful clinically just to follow the fracture to see how it's healing and remodeling. This is a case of a 33-year-old male who twisted his ankle about a month prior to seeing me. Still complaining of mild pain with walking, and he feels he cannot run. On physical exam he did have some nodularity, just superficial to the tibialis anterior tendon. Initially I thought it may just be a post-traumatic type ganglion. However, upon further review and after getting an MRI, he essentially had Tenosynovitis of the tibialis anterior tendon. Also looking back at his ultrasound, the fact that the fluid is pretty much spread out and kind of diffuse over the tibialis anterior tendon goes against the ganglion and is more in favor of Tenosynovitis. Also, he suffered from a severe sprain of the anterior tibal ligament as well as the deltoid ligament. So, 33-year-old male sprained his ankle about a month ago, presents today for initial visit actually. He's complaining of a little lump here in the distal anterior leg, just probably above the joint line. Probably may just be a post-traumatic type of ganglion. I'm going to go ahead and just evaluate it. Seems like it's basically maybe coming off the tibialis anterior tendon. The left side of the screen is distal. We're just looking at it as, here's this tibia. And we can get the tibialis anterior tendon. And here's that fluid again. Again, upon review, this is probably more consistent with Tenosynovitis versus a true ganglion. But while I was examining it, since it had that feel of the ganglion, I decided to call it that. And you can see some fluid collections above it. Perhaps it felt like a ganglion because of the significant amount of inflamed synovium around the tendon, which can give a nodular type of feel to the tendon. That's our distal tibia, articulating with the talus. And here's just a view of the tibialis anterior tendon crossing over the joint. We got the lateral malleolus or the distal fibula on the right side of the screen, and then we got the talus on the left side of the screen. So here you really can't make out a clear-cut compact fibrillar anterior tibial ligament. You could see some fibers, but nothing continuous. And again, this is consistent with a pretty severe sprain of the anterior tibial ligament. So we're trying to look at the anterior tibial ligament. And I could see some fluid around it, some irregularity. Really hard to get a discrete look at the ligament going across. and this was consistent with his MRI findings. This is a 22-year-old male that saw me for his right ankle. He was playing basketball and just twisted it bad the day before seeing me. Initial x-ray was concerning that he may have a syndesmosis injury, as there appeared to be very subtle widening of the medial joint mortise. We therefore got an MRI which showed a moderate sprain of the anterior tib fib ligament, also a full thickness tear of the anterior tal fibular ligament, and also a muscle tear of the extensor digitorum longus muscle. We subsequently did an ultrasound, which was reassuring because it did not show, I think, a moderate sprain of the anterior tib fib ligament. It just showed essentially a mild sprain, I believe, of that ligament, as most of the fibers appeared to be intact. It did, however, demonstrate a complete tear of the anterior tal fibular ligament, and it did demonstrate tearing of the distal extensor digitorum longus muscle. 22-year-old male twisted his ankle playing basketball last night. Very tender medially and laterally, a lot of swelling, difficulty walking. He had an x-ray done which shows some very subtle widening of the medial mortise. Concerned there is a syndesmosis injury. He had a negative squeeze sign, but he is tender around that whole region. Here we're going to do another ultrasound again. MRI showed high-grade tear of the anterior tib fib ligament, complete tear of the anterior tal fibular ligament, and also moderate tear of the calcaneal fibular ligament. The deltoid ligament is preserved. I'm going to go ahead and just kind of look at that on the ultrasound. Right side of the screen is lateral. We can see the tibia crest, and we got tibialis anterior. We're going to just try to keep an eye on flexor digitorum longus, which is the muscle most posterior. You can see the interosseous membrane. And here you can see the anterior compartment of the leg with tibialis anterior just right above the tibia, which is most anterior. And then as you go posterior, you can see the extensor digitorum longus muscle. And just looking for a lot of edema within that muscle, which his MRI showed. We could see some signal within that muscle, which we see here. Sometimes you may think that fluid may be anisotropy of a tendon, but this is actually just true fluid within the flexor digitorum longus muscle. Here we are, we're going distally. We can see the extensor tendons. You can see some fluid around those tendons as well. Right above the tibia, you can see all that signal within the flexor digitorum, extensor digitorum longus muscle, excuse me. This is what we're talking about, extensor digitorum longus. In the anterior compartment of the leg, you can see all that kind of fluid and irregularity consistent with a muscle tear. And here the MRI is just a little bit bigger, so you can make out the fluid within that anterior compartment, how almost the entire extensor digitorum longus muscle is bright on the axial MRI to the right. On the MRI to the left, you can see that fluid just superficial to the extensor digitorum longus tendons. I'm going to change my orientation. Fibula on the right, tibia on the left, and you can see fibers going across. You can see a pretty intact anterior tibiofibular ligament going across. The syndesmosis appears to be preserved, kind of in a coronal oblique plane here. We're going to take another peek at his ATFL. We're going down now. So here we got the fibula on the right, the talus on the left, and you can just see really no anterior tal fibular ligament, which we kind of saw initially. Ultrasound did show just basically complete tear of that. It's got a lot of irregular fibers bunched up in that region, which may just be some balled up ligament. We're going to try to look at his calcaneal fibular ligament. We are basically going vertically right down from the lateral malleolus. See the peroneal tendon. So it sits right under the peroneal tendons. You can see his peroneal tendons, which are intact. And you really just don't see much of a ligament. I think here we can kind of get a glimpse of it here. And here you can see the ligament is preserved, but there's some dark signal within the substance of the ligament, consistent with a partial tear, but not a complete tear of the ligament. I'd like to thank you for watching this presentation, and I hope you found it useful and interesting. I hope I demonstrated that ultrasound can be useful both diagnostically and interventionally. And I'm looking forward to sharing more cases with you in the future.